Hello everyone, welcome back to our channel. I'm Dr. Ashmita. Today in this video, let's continue with the recently described thyroid neoplasms series. In our last video, we have discussed about the high-grade differentiated thyroid carcinoma. In this video, we shall discuss about the Hobnail papillary thyroid carcinoma. Coming to the Hobnail papillary thyroid carcinoma means it's a new variant of papillary thyroid carcinoma which is characterized by loss of cell polarity and cell cohesion. That it is due to downregulation of E-cadherin and mislocalization. Mislocalization. That means mislocalization of beta-catenin. Beta-catenin is normally present in the cytoplasm. It is translocated to the nucleus. Now it is translocated to the nucleus. So both of which will result in hobnailing of the cells. That is, the tumor cells become like hobnail cells that with apical bulge that is lining the papillae or forming the micropapillary clusters without true fibrovascular core. Let's break down this definition. So, as we have said, it's a new variant of PTC, as the name suggests, Hobnail papillary thyroid carcinoma. So, it is a papillary thyroid carcinoma with Hobnail morphology. So, it's a new variant which is recently described in the WHO 5th edition, characterized by loss of cell polarity. Cell polarity means, so this is a basement membrane. Cell is resting on the basement membrane, and the nucleus, it normally it is located to the base. That is basally oriented nucleus. Basally oriented nucleus. This is the normal orientation. This is the normal polar cell. It is called polarity. So loss of cell polarity will result in this nucleus, which is originally located at the base, it will move upwards toward the apex. So it will translocate. It is moving upwards. It is dislocated to the apex. So this is called apical location. Apically oriented nucleus. Apically oriented nucleus is said to be loss of polarity. It is called loss of polarity. And cohesion is loss of cohesion. So these cells, they are stuck or they are adjacent cells. They are adherent to one another by means of certain glue called E-cadherin. E-cadherin will act as a glue that make these cells stick to one another. When this E-cadherin is down-regulated, the cells now no longer stick to one another, they disperse. Now the cells will disperse. So the cells will now disperse. This is called loss of cohesion. Dispersion is called loss of cohesion. That is disperse because of downregulation of E-cadherin. What will happen if the cell loses its polarity and cohesion? It will result in hobnailing of cells. Hobnails are cells with apical bulge. See, as said, now the nucleus will shift towards the apex. Towards the apex. It will appear as if there's apical snouting. Like cytoplasm and nucleus, they bulge out from the apical surface. This and the stalk, the narrow stalk and the broad base. The apex is broader. So the nucleus and cytoplasm appear as if they are bulging out from that apical surface. This apical bulging is given the name hobnail. Hobnail is nothing but a nail which is hammered into wood. It has a thin stalk and a broader head. So these are the hobnails. These are short nails with a thin stalk and a broad head. They have broad head. These are the broad head and narrow stalk. These are called hobnails. So the cells appear like this. The base will appear narrow and apex will appear broader because of nucleus and the cytoplasm bulging out towards them. So apical bulge is given this hobnail cell appearance. So this is a typical glassware with hobnail appearance. The glassware is given this hobnail appearance, that means nothing but some bulging out from the glass surface. These are called the hobnail glass appearance. Here also, these are the hobnail glass appearance projecting out. The cells appear as if they are projecting out from the apex towards into the lumen. That is given the name Hobnail cells. And these Hobnail cells will line the papillae. Papillae are nothing but the papilla, two like finger-like projections. The classical PTC, classical papillary thyroid cancer, it has the architecture of papillae, that is finger-like uh, projections, that is arborizing architecture. So these papillae, they are lined by this tumor cells which have this hobnail morphology. And because they have lost their cohesion, the individual cells will disperse out. They are scattered singly on the slide and appear, and they may form say micropapillary clusters. And they don't have a true fibrovascular core because they are dispersed. The underlying supporting structure, their fibrovascular core acts like a supporting structure. The supporting anchor is lost because of loss of E-cadherin. Because of loss of E-cadherin and this upregulation of EMT gene, that is epithelial mesenchymal transition genes, the cells will migrate because the cells will migrate because of downregulation of E-cadherin also. So the loss of supporting structures, this loss of supporting supporting anchor. So there's no true fibrovascular core in this papillary or the micropapillary clusters. So hobnailing means the nucleus and the cytoplasm will bulge into the lumen from the apical surface of these tumor cells. And to diagnose it as a hobnail PTC, what is the diagnostic criteria? So on a slide, at least 30% of the tumor cells, 30% or more than 30% of the tumor cells must show this hobnail morphology for making this diagnosis. So this 30% of tumor cells is the criteria. It's a cutoff mark. This is about the introduction. Coming to the molecular pathogenesis, like what are the mutations responsible for pathogenesis of Hobnail PTC? Hobnail PTC, it is a high grade variant. That means a new variant is aggressive. So it must be arising from a pre-existing papillary thyroid cancer. So a well-differentiated papillary thyroid cancer, that is a pre-existing, it is a pre-existing papillary thyroid cancer that has turned into this high-grade aggressive variant, which is nothing but the Hobnail PTC. Hobnail PTC. So, what are these mutations responsible for classic PTC? BRAF V600 is the most common mutation. So, the story begins with BRAF V600E mutation, which is responsible for this classical PTC by activating MAP kinase pathways. So, on this mutation, by this BRAF mutation, MAPK activation occurs, because of which it will result in classical PTC. So this is a classical PTC is a indolent slow growing tumor. From this stage, if certain additional mutations add on, like TERT promoter, that is telomerase reverse transcriptase. Telomerase reverse transcriptase promoter gene mutations will result in tumor cell immortality. That means the tumor cells will escape the immune surveillance. They will survive, they will proliferate. So this immortality is given by this TERT promoter genes which undergo mutations. TERT means telomerase, telomerase reverse transcriptase. And secondly, TP53 mutation, the guardian of genome, which acts like a tumor suppressor gene, that is lost. So there is loss of tumor suppressor function, which will cause this uncontrolled tumor cell proliferation. And this E-cadherin down regulation, the glue, the stick, the fevicol that keeps the cells together is lost. So the tumor cells will disperse. Disperse means it will promote, like it has a potential for invasion and distant metastasis. And beta-catenin nuclear translocation, normally present in the cytoplasm and gets translocated to the nucleus, it will result in EMT promotion, that is epithelial mesenchymal transition. The epithelial cells will transform into the mesenchymal cells like a spindle cells, which are more useful for easy spread, for more. It will promote the mobility. It will promote the mobility, and therefore it is responsible for invasion and metastasis. And there's loss of polarity genes. Polarity means cell polarity. Normally it is basally located nucleus. Loss of cell polarity means this nucleus will be shifted to the apex. The apical shifting of the nucleus, the apical bulge, is called loss of cell polarity. So the loss of polarity genes, the polarity is maintained by PAR3, PAR3, LGL2. These are the two genes that are responsible for maintaining the polarity of cells. These genes are lost. Altogether, everything will result in Hobnail morphology. The nucleus shifted to the apex, giving an apical bulge, that is, it will ultimately give this hobnail morphology, and it is responsible for the aggressiveness of the tumor. This tumor hobnail variant is highly aggressive, it is fast growing, it will invade fast into surrounding stroma, it will metastasize to distant sites. Because of this aggressiveness is given by the TP53 TERT promoter and E-cadherin, beta-catenin and loss of polarity genes, all this contribute to that hobnail morphology and this aggressive behavior of this tumor. And this tumor, it will show the typical nuclear features of PTC. Though it is high grade, it still maintains its appearance, classical nuclear features of the PTC, like the nuclear clearing. There is nuclear clearing, nuclear grooves, there are pseudo inclusions, there's nuclear crowding, overlapping. So all these are the classical PTC nuclear features. All these features are also shown by this Hobnail variant. So typical nuclear features of PTC plus addition of this high-grade aggressive course is this characteristic feature of Hobnail PTC. It is because of BRAF V600E which result in proliferation. TERT promoter TP53 responsible for dedifferentiation. That means dedifferentiation is the loss of this normal architecture. Like normal PTC, cell morphology is not present, it becomes Hobnail morphology and it is resistant to apoptosis. These tumor cells do not undergo apoptosis, they survive because of this TERT promoter. It is responsible for cell immortality. And this loss of E-cadherin, which is responsible for loss of polarity and architectural control as well. So these help in loss of polarity means again the cell is ready to invade. So early invasion into the stroma and into the blood vessels are because of this E-cadherin down regulation. So these are the genes responsible for the hobnail morphology of classical PTC. It will result in the aggressive course of this variant of hobnail papillary thyroid cancer. So this is about the introduction and the pathogenesis, the molecular basis of pathogenesis of Hobnail PTC. In our next video, we'll continue with the morphology, the investigations, clinical course, both microscopic and gross morphology. So if you like this video, please like, share and subscribe to our channel. And thank you.